Dr. Rafika, we can start now.
Thank you. Assalamu alaikum, everyone. Thank you for joining on this closing ceremony for family medicine certification course. My name is Zahid Rafiq. I'm a family doctor. I'm chair for this certification course. And with me, we have Dr. Taimur Khan. He's Apna Merit Chair. And Dr. Azhar Chaudhry is also on the screen. You can see him. So the way today's program works is I'm going to go through a presentation of this, just a brief overview of the course which you guys have completed. And it's such a good news that this course has been completed within a year, and we have covered lots of common topics related to family medicine. And after that, I'll give it to Dr. Taimur Khan, who's the chair for Apna Merit. He's gonna briefly discuss about the course, plus give us further future directions as to the family medicine course, and also other new initiatives he has taken for this coming year. So I think let's start with the presentation. I'm gonna try to share the screen here. So we are here for it's good news, we are here for closing ceremony for Apna Merit Family Medicine Certification course for 2022-2023. So the way the course was started, just gonna give you a background. Let's move, trying to move the screen here. So that's, if you look back at the history, how this course started. If you see the top left corner, the first poster, the way it was started in 2019, March 4th to 5th, 2019, we had a first ever Apna Merit conference in Pakistan that was held in RMU. That was all the participant organizers for the conference. So at that time, Apna Merit chair was Dr. Shahid Rafiq, and Dr. Danish Bhatti was co-chair. That was the first initiative which was taken by Apna Merit. And the conference name was Building Primary Care Capacity in Pakistan's Critical Need. So everybody was realizing at that time that primary care is definitely the critical need for Pakistan, because as you have seen, in Pakistan, people can go wherever they want to go to different specialties. Family medicine was non-existent. Although there were some private medical colleges that started family medicine program, but there was no structure to it. So we engaged different university vice chancellors were there, different stakeholders were there, government officials were there. We had a meeting with Prime Minister Imran Khan at that time. So that's where whatever feedback we gathered at that time, we structured family medicine certification program that year. And major contribution was from co-chair at that time, Dr. Danish Bhatti, who was the chair for 2022 and 2021 for Apna Merit. And first ever course was started was 2020 and 2021. So you can see at the bottom, that was our closing ceremony, which we had done in October 30th, 2021. At that time, our chief guest was Professor Riaz Qureshi, Apna President-elect, and past President, Dr. Shahid Rafiq joined for that session. But during that session, we had 27 participants who completed the course at that time. Although participation was more than that, there were the way the program is structured, people can register for 1-year course. This time we had about 45 people who were completed the whole 1-year course, and they were registered. But participants were about 1,700, and people on the average family physicians from Pakistan, general practitioners from Pakistan. They joined each on average about 110 participants for each session. So let's move to the next slide here. So here you can see myself and Dr. Noreen Rafiq. We are course directors for this year course, which is completed. And I would like to welcome Dr. Morton at this time. She's just joined us. So this is a leadership for merit. As I mentioned, Dr. Shahid Rafiq was merit chair in 2019. Dr. Danish Bhatti was co-chair at that time, and he took over the reins in 2021. Dr. Babar Rao, who is long time associated with Apna Merit, he was chair in 2022. And this year we have Dr. Taimur Khan, he's chair Apna Merit 2023. And we'll hear from him after my presentation. So this is course rotation. We had different specialty rotations for this year, including cardiology, neurology, psychiatry, pulmonology, and multi-specialty rotation, which includes most common family practice day-to-day topics. So I'm just gonna briefly go through different rotations. First rotation was cardiology rotation, and lead for that rotation is Dr. Mariam Morton. She's a professor of medicine, Loma Linda University and University of California, Riverside. And she's also chair Apna Merit Cardiology Committee. She just joined us also. And she was always there for that cardiology rotation, and she organized, structured very well. And we covered most common family practice related topics. As you can see on the screen, there are different speakers and panelists and moderators. We are very, very thankful for all of those speakers and panelists and moderators to organize the session and conducting the session. And special thanks to Dr. Morton for organizing that. And for her, the sessions were like so early in the morning, 6 a.m. Pacific time. I think sometimes it was 5 a.m. Next rotation was a neurology rotation, and lead for that rotation was Dr. Danish Bhatti. He's associate professor, education chair for neurology, director neurology clerkship at University College of Florida. So he was co-chair. He was chair in 2020, and he still is very much associated with Apna Merit. So the topics which were covered, as you can see on the screen, they are all related to family medicine. First session was history and examination, which is very important, dementia and approach to delirium, dizziness, differential acute stroke for CPC, epilepsy, and approach to headaches. You can see the speakers there, and we are again thankful to all the speakers and panelists and moderators for that session. Next session was psychiatry, which was led by Dr. Noman Ashraf. He's a program director, general psychiatry and addiction medicine fellowship programs, KCU GME Consortium, Ozark Center. So again, the topics were related to family medicine, anxiety disorder, child and adolescent disorder, mood disorders, other psych disorders, substance abuse, and somatoform disorders. We had different speakers there, and we are very thankful to their participation, panelists and moderators for conducting that very interactive sessions. Pulmonology was led by Dr. Fawad Chaudhry. He is Assistant Professor of Medicine, Medical Director of Interventional Pulmonology, University of Oklahoma Medical Center, Oklahoma. So topics were covered was asthma, COPD, sepsis, and pneumonia. again, we are very thankful for speakers and panelists and moderators for conducting those sessions. So our multi-specialty rotation was led by Dr. Junaid Razak, Dr. Taimur Khan, Noreen Rafiq, and myself. And we covered a number of sessions which are common to family medicine. They were, but you can see on the screen, there were lots of topics which are covered. And again, we are very thankful to our speakers, panelists, and moderators for joining us and sharing their knowledge. So as you can see on the screen, our participants, total number of participants were 1,790. That was Zoom registered participants. On average, we had attendance about 110, more than 110 per session on average. So people who participated for 1 year course, number was 45. So those are the people who were registered and participated and completed the whole course for 1 year, and they will get certification from Apna Merit Academy. So as you can see, Apna Merit Academy has grown quite a bit, and these sessions were under Apna Academy, and there's a learning platform where people can, their live sessions are available. Live session was, whichever live session was conducted, they were all available on the learning platform. So people who are registered, they can go back, they can learn, they can, they have access to all those sessions in the academy. So also we had some portal discussions, there was WhatsApp group. After the session, we had great feedbacks, people were sharing ideas, question and answers. And I will mention one thing, our speakers, they were wonderful, panelists were wonderful. They were answering most of the questions online after the session, and they were available. Typically, sessions were about 30 minutes of presentation and 30 minutes of question and answer, and some sessions have gone over 1.5 hours and more than that. So for registrants, people who are registered for 1 year course, they had assessments after the session, each session, and they were supposed to complete this assessments within a week, just before the next session. So there were different kind of assessment. One was speakers were sharing some article. People were supposed to read the article and submit 2-minute summary regarding that topic, what they have understood. And second assessment was after the session, they were supposed to write 3 multiple choice questions related to the topic. So that was part of the assessments. And feedbacks, we got good feedback from participants. They liked the sessions and they really enjoyed interacting with the speakers. And most of the sessions were interactive. And my special thanks to course directors, rotation leads, all faculty, speakers, panelists, moderators, and especially all the participants. Without you, there won't be any course. So our upcoming course, Family Medicine Comprehensive course, so we're looking into next year course, Neurocritical Care course, Addiction Psychiatry course. And I'll leave it for Dr. Taimur Khan to update us on those courses. And as you all know, you can connect with us on this email or website and Facebook page. So with that, I will hand over to Dr. Taimur Khan. I will stop sharing my screen here. Dr. Taimur Khan, as I mentioned, he's Apna Merit Chair. And over to you, Dr. Taimur.
Hello, Assalamu alaikum. Thank you. Thank you very much. Can you see me? Can you hear me?
Yes, we can
Yes.
hear you. Go ahead.
Wonderful, wonderful. So, thank you very much, Dr. Rafiq, and all the participants, all the speakers, all the volunteers for your time, dedication, commitment for education, and bridging all the gaps in this such a comprehensive specialty of family medicine, which literally encompasses every aspect of uh, care and every aspect of every type of population. So I'm very glad to kind of see very successful completion of the course, and I've been really closely following up on the sessions, feedbacks, and interactions from the participants and in their groups, and had a chance of interacting on some of the sessions. And it is really kudos to the course directors, the every rotation director. You have done a tremendous job, and congratulations to all the participants who completed the course. And we hope that the knowledge you gained from the interaction will certainly help your clinical practices, and we look forward to more feedback, and so we can keep on improving the course, and keep on expanding the discussion topics pertinent to the needs of our participants. And certainly we are very blessed to have um, participants and the speakers from all the subspecialties in this, with their strengths bringing on the table. I think it has been one of the very phenomenal. I always get some emails from the neighboring countries and other, and I think we have allowed it in some other courses where we kind of allow and help out whoever wants to join. It's kind of information for them to be participate and benefit from that. So having said that, for this year, I think certainly as Dr. Fig mentioned, the plan is to go for the upcoming courses. At the same time, the uh, the merit is we this is like one of the very successful programs apart from the stroke fellowship, and previously we have done other different types of courses, but this year we are doing adding few more courses, including neurocritical care, as Dr. Rafiq mentioned, and also a brief course on interventional pulmonology. And our goal is to that in our winter meeting we will do some hands-on workshops as well for interventional neurology and interventional pulmonology, and also we may add some other hands-on ultrasound courses depending on the feedback and requests that we get. So because you may all know that we do get um, a lot of experts travel to Pakistan on the in the winter meeting in Islamabad in the Peshawar area this time, and our goal is to do combined sessions in Pindi and Peshawar region. And over there, certainly would love to interact and meet with everyone. If you can join, and we can certainly, or you will find our workshops helpful as well. So our goal for this year was is to certainly supplement these modules with some hands-on training as well, if it is needed and if it is felt and necessary from the directors and also the participants. But two are in pipeline, and that is open to. We'll share the registrations in the R groups, and you are more than welcome to join if it is along your areas of interest and you feel like it may help your patient population as well. Um, I think that's it from my side, and I'm thankful for the open leadership, Dr. Shahid and Danish Bhai and other people who kind of have been the driving forces for the courses in the past, and also they continue to help us with their leadership skills and their input regarding the course. And certainly all the very thankful to the time and commitment you all the volunteers have put in. That's what makes it very special. So that's it from my side. Over to you, Dr. Rafiq, and if any questions for me, I'd be happy to answer. We cannot hear you, Paul.
Sorry, I was mute. Thank you, Dr. Tamur Khan, for giving us a brief overview of the future. And thank you for mentioning about winter meeting. That's a great suggestion. If we can do some family medicine workshops in the winter meeting. So we, as you mentioned, as directors and faculty, we can look into it. And that'll be great if people can join there. So I think we can share the information as soon as it's available with the participants. So next I will invite Dr. Morton to say a few words, and then Dr. Azhar. And then for participants who are there, if they would like to say or share their thoughts or participate, if they can raise their hands, and we'll take as one by one, we can ask them to join. So over to you, Dr. Morton, please.
Thank you so much for the kind introduction. As you know, cardiology is bread and butter for family practice medicine, not just for internists as well as for other subspecialties. We try to choose the speakers based on their qualification, based on their subspecialty, based on their teaching abilities, as well as their interest in general to promote good health in Pakistan. All of the speakers were very thankful to the participants. They enjoyed the questions that were put forward by the participant, making it a very active rotation. All the topics chosen for family practice were chosen by family practice participants themselves and their interests. So we want to make sure we continue doing what is important for the participants, not what is good for general knowledge for the speakers themselves. And it became more like a two-way traffic, what US is doing compared to what Pakistan is doing. And we learn from each other, and we want to continue doing the same. Thank you so much.
Thank you very much, Dr. Morton, and thank you for joining us today. Over to Dr. Azhar Chaudhry, is one of the faculty for Apna Merit Academy. Dr. Chaudhry.
Thank you for inviting to attend the ceremony. And yeah, I've been part of a few sessions as a panelist, and I think it's a great initiative, and it does help all the doctors and family physicians, keeping in mind there's no such a structure, family medicine structure in Pakistan. Dr. Rafiq, you mentioned about Imran Khan and meeting him. I'm not sure whether any progress on that end, because giving a physician knowledge is a good thing, but to practice it, they need a kind of system and facilities. And like in UK, we do organized manner primary care and do all those things. I'm asking because I'm from Kashmir, and I'm trying to kind of develop UK type primary healthcare system there, where basically at BHU level, medical officer can diagnose and manage at least diabetes, blood pressures, and these kind of things, just following the simple pathways as we do in the UK. Even nurse practitioner can manage these things. Just need a system. So, but it's a very uphill struggle. It's lots of hurdles and no stability. So I think giving them education is important, and it is one of those things. There's no any other options. But moving forward, I think your organization is quite big now and quite influential and well known. Whether through this organization and this platform, you can influence the government, make some kind of changes, at least, so that the public can get benefit, because the poverty going up the roof and people cannot go. I mean, I know maybe 20% people can afford it, but rest of them can't afford it. And especially diabetes, you can know that is basically so much now there. I did a couple of years ago basically what is called I went to Muzaffarabad, and that's where I invited all the people and did a medical camp. And I was surprised to see people in their 30s, they are with diabetics and heart problems and all those things. There's no prevention whatsoever. There's no awareness whatsoever. And I think only medical officer who kind of work in BHU level, they can do these things. Consultant can't do these things. They live in the hospital, they work in the hospital. So that's the only point. I know it's a difficult one, but if keep struggling and keep trying, then I think maybe we can do whatever we can.
No, excellent, Dr. Azhar, very well said. And definitely when after the first conference, these things were discussed in the conference, that there's one thing, like we can provide education, we can empower people, we can empower GPs with the knowledge. But sitting in the system which doesn't work, like family practice, like in North America or in Europe, the way family practice is, that's the backbone of any healthcare system. So if that's not there, it becomes very difficult. So as you can see, or you know the situation in Pakistan, so we can do whatever we can stabilize or provide, empower people. So through that conference in 2019, if I see the progress, what has been made is there's more awareness, there are more specialty, family medicine specialty courses in different universities. If I mention about Rawalpindi Medical University, so after the conference, they started with a 6-month course, certification course, then 1 year, and now they started an MD course for 4 years, which is first 2 years is like a certification course also. Similarly, KE started the course in family medicine. We have some, I would like to mention some names in family medicine in Pakistan, which are leaders of family medicine. Dr. Hina Chaudhary, she's always there. She's conducting different sessions. She's involved with Apna Merit as well. Dr. Nasir Shah, Dr. Jalil Khan, who is from Khyber Medical College. He's, I think, associate professor there for family medicine. He has trained so many people there. I visited him in Khyber Medical College. Similarly, Dr. Sadia, she's assistant professor in RMGU. So there are things that are happening, of course, not at the pace that we would like to happen. So things are happening if we keep on pushing, and you're very right, like Apna has such a great platform, especially if we're going back there I'll be there in December also for winter meeting. So you interact with different people. And of course, if there is willingness, you engage with people, you keep on hammering the same thing, things will change. And I think biggest change will come from our participants who are participating in these sessions, and they're spreading the knowledge, and the demand from them also can definitely make a change. Thank you for sharing your thoughts. Thank
you.
So if anybody here from the participants want to share their thoughts, or they have any questions, if you can please let us know. We can unmute, and you can, there's Dr. Faiza Tariq. We can allow her. Yes, Dr. Faiza Tariq.
Assalamu alaikum, Dr. Zahid, and everyone from Apna team. I have previously attended this session as a moderator, and this year on, I noted it to be a very interactive one, very learning one, and I thoroughly enjoyed the whole year of attending these sessions, moderating them with you people. I've done so many things, and I would suggest to all the participants to, if they still want to rejoin, I think they should. It has been such a great experience for me. Thank you so much.
Thank you, Dr. Faiza. Of course, with the future courses, if people who have already registered and later on they want to join, they're free to join their session for sure. So there's a question for Apna meeting. So Apna winter meeting is, this time is happening in Khyber Medical College and Rawalpindi Medical University. Khyber Medical University and Rawalpindi Medical University, and that's going to be, I think, around workshops start from 17. So, and then some sessions, and 25th is going to finish. So exact dates, I think it's on Apna website, but normally starts from 17th of December or so. So anybody else there? So for winter meeting, for sure, once we have Apna Merits plan, we can discuss there. Last year, I think there was research and innovation was the theme from Apna Merit. This year, I'm not sure, Dr. Amur, if you know, if we're doing anything for winter meeting. For my side, I think for family medicine, we should conduct some workshops which are related to family medicine topics.
Absolutely. So if you please let me know whatever you think workshop we will do our best to accommodate that. I will share my dates of Peshawar workshop days so that we can certainly give you like work on all the logistics and details in terms of the equipment and whatever is needed. That would be great to have it and certainly pertinent to the course, the ideas that you touched, and if the course participants can be there, will be great to kind of see them in person as well. I'm so far right now is neurology, pulmonology is been confirmed, and others we are open to any like if Dr. Moten and anyone want to echo workshops, EKG workshops, whatever you think is pertinent, ultrasounds, whatever you think procedural wise, we'll be happy to accommodate.
Excellent. I think that's great, and that will be a discussion between faculty of Academy and final. We still have lots of time, but I think we can, if we can finalize it in next couple of months, that'll be great. Any other participants want to share any words? If none of them want to say anything, then we can. I think we are at the end of the ceremony. And so just a quick reminder for participants who were registered for whole year, they need to just complete their final assessments so that their certificates can be provided to them from Apna Merit Academy. So I think I don't see any further questions, or none of them raised any hands right now. So the final thank you to everyone for participating, and it was a great experience interacting with you guys for our last 12 months. And we'll come up with new program and with a new energy, and starting date will be discussed later or announced later. And thank you, Dr. Taimur Khan, for joining, Dr. Moten, Dr. Azhar Chaudhary. Thank you all the participants, and we'll see you with the next year's course. Thank you very much.